Hello, everybody. This is Dr. Troy here, coming to you on our amazing episodes of Everything Disc. I've got a great guest with us today. I'm excited to jump into this thing. He's from North Carolina, Dr. Nick. He's been in practice over 16 years. He actually, I've known him for a long time. We train in circles together in our profession, and it's been amazing to get to know him. And he's got a great family. And I'm excited to have him on the show today and have him share his knowledge about what it takes to get the body healthy, get it functioning better, to get your body to perform at peak levels. He's got some kids that are really high level in sports. And I know Dr. Nick's got a background in sports and he played football and golf and all kinds of things. And we'll talk about maybe a little golf because I always love talking about golf. We'll talk about that at the end. But Dr. Nick, I want to welcome you to the show today. Thanks for taking time out of your schedule. Why don't you tell us a little bit about what you do, where you practice, and what kind of things that got you into the profession that you're into?
Yeah, sure. I'm in Charlotte, North Carolina, out kind of on the northwest side, up on a lake called Mountain Island Lake, hence Mountain Island Chiropractic. My name's Dr. Nicholas Knutson. I'm from Iowa. Uh, got into chiropractic because the Fountainhead was in Davenport. I played some college basketball and kind of knew that I was going to get into some kind of body oriented thing. So I went down the strength and conditioning road, then started doing a kinesiology degree from Northern Iowa, where I went and played, and then went into the weight room there and started going through where if you had to get a grad assistant, started going through that process. Met my lovely wife is in a little town called Clinton outside of Davenport. And I was like, I'm gonna go check out this chiropractic thing. And I thought, if I'm gonna go to more school, you could go the chiropractic route or I could get a master's and try the strength and conditioning stuff. I was definitely a gym rat, loved it, loved every aspect of it, tried to get as humanly strong as I could. And still dunk was kind of the role. But anyway, kind of fell in love with Palmer and jumped right in. It was kind of an interesting chiropractic thing as my dad's golf buddy was a chiropractor. And to be honest with you, on a lot of different things, I didn't necessarily love always getting adjusted in my lower back. And it
Mm-hmm.
ended up being
Mm-hmm.
that I had an injury at a spondy.
Okay.
And that
Spot.
was
Yeah.
part of the reason. But he was kind of the go-to. So like I broke my thumb and I broke my nose, and he ended up being the first guy we went to. And he'd give
Yeah.
us a straight no BS answer. His dad was like the athletic director at the high school. And so he just had a lot of trust and family rapport with us. And so he kind of became a mentor. I went the Palmer route, loved it. And then actually kind of went upper cervical actually in
Okay.
some stuff
Okay.
and started studying NUCA. And then my wife was an ER nurse the whole way through school, and she worked nights. And so we had kind of off and on, got done, ended up meeting with a doctor who was an upper cervical doctor, a DAPSI doctor, and he had Pedabon. So it was kind of a weird mix. And he brought us to Charlotte, got to learn under him. We also, I guess we had decompression. We had a gamut of stuff. So I got to go train under Burl Pedabon before he passed. I
Yeah.
got to train under Thompson, Dick Holtz with NUCA. So I got a lot of, I always tried to learn as much as I could and learn
Yeah.
different facets because obviously the body's complex. And so came to Charlotte, have had 2 kids, coach an Under Armour basketball team. My son plays basketball, football, lacrosse. We go all over. My daughter's a softball pitcher, volleyball. And so we're always in sports, but really just found a practice out here and started with the door to door lunch pail work, you know, uh, please come in, please let us show
Yeah.
you how awesome chiropractic is. Obviously show people without drugs and surgery. And that's really what our basis has been. I still to this day, I'm really strong on just being like, hey, this is my family business. Like we're here about results.
Yep.
Everything
Yep.
else will come. And we've been very blessed. And it's been awesome. Now my wife's managing the place as the kids get older. And so we've made it a very strong um I guess tactic that we're gonna work together. And our mentors, the Schofields, that's kind of how they go. And so we have decided that's what we're through the ups and downs and learning how to manage people and learn how to take care of people. That's how we're gonna do it.
Yeah, absolutely. Well, what kind of I mean, I didn't know some of the stuff that you told me there, so which is kind of cool. So, you know what popped into my brain was Jack LaLanne. Do you remember that guy?
Yeah.
So I was watched him when growing up, and I'm like, man, Jack, he's just like into fitness, and he's like, look at what that body can do. And then I finally realized, after I graduated chiropractic school and all that, he was actually trained with a chiropractic degree. So he was a chiropractor. He never talked about it, but he was always into fitness and doing all these things on, Dave Letterman or Jay Leno. It was just pretty cool seeing what he could do. So what that's what reminded me of your background there a little
Yeah,
bit
and
about that.
I think Arnold's even came out and talked about getting adjusted too, like,
Yeah,
as he
no,
was training,
absolutely.
all that stuff.
Well, Arnold's friend Franco Colombo. He was a chiropractor. That's one of the
Yeah.
reasons I got into chiropractic because I looked at the bodybuilding encyclopedia and I'm like, who's this? What's this DC? And I started going, oh, it's chiropractor. And then that's what really motivated me to be in this profession. But changing gears a little bit, what kind of cases do you see that present to your clinic?
So, we're definitely a family base. We do see personal injury stuff, but a lot of family base. We see anywhere from infants to geriatrics, but we see, as far as, it does seem to be more and more disc involvement with pretty much everything. And so we see a lot of that. And then we try to attack that at a lot of different angles as far as chiropractic, decompression. And then we've brought in a soft wave TRT, and it's really helped with inflammation.
And the software, what does how does that work? Can you explain that to our listeners?
So it's it's an interesting thing. It's a light wave that goes through ultrasound gel, goes about as deep as a soda can, but basically, in a sense, is a non-invasive, non-inflammatory, non-focused electrical wave that goes through the body, helps push out any inflammation, but also brings in and really activates the vascular, the stem cells, and all that stuff. And so it's been wild. It's been kind of a wild journey with it. We brought it in and we thought more like neuropathy stuff with the feet. And then we had people kind of do it and they're like, oh my gosh, I can feel the ground. And we're like, whoa. But obviously, as we know as chiropractors, that neuropathy is not always caused by, hey, I can't feel my feet. There's something else.
Yeah, that's just the symptom. That's just the
That's just the
symptom, right?
symptom. And so again, our philosophy in our office is not to just cover up the symptoms. So we package all that in together and try to figure out, hey, is there something going off, up in the pelvis? Is it up there in the lumbars? Is it the quadrate? What is going on to balance? And then obviously too with the upper cervical stuff, what I've probably my biggest thing, I mean, I can't even say how many CrossFitters, weekend warriors, Panthers come in, and I always say they want to rub, tug, drug, needle, do everything they can to that low back spot where that nerve supposed to come on. And I'm like, man, if we would have put your head on straight after they cleared that inflammation, guess what? It might stay. And then
Yeah,
they're like, oh my gosh, it was my neck. And I'm like, well, kinda, but
yeah.
if your
It's all
head's not on
connected.
straight, it inflames that disc again. And
Yeah, yeah.
so that's kind of our gist of our philosophy.
Yeah, and it's interesting. When I had a herniated disc, 15 years ago, one of my professors said, you need to lay on these wedges. He says, coming from your neck, that the disc involvement is starting in your neck. And some people go, how does that happen? But it's all connected, one big kinetic chain. So I'm glad you mentioned that. What do you see a lot of disc cases come into your office? How do they happen? How do they present? What kind of things, clinically do they present with and complaints that you see?
I mean, as far as like neuropathy, like different radiculopathies with the disc, we see car accidents. Um, obviously with the weightlifting trend, and the CrossFit and the deadlift, the USA stuff. Being the strength and conditioning on my website, I say USA. I'm a USAW certified coach, so then they like that. But so those are a lot of the discs I see. You know,
Yeah.
to be honest, yesterday we were rocking and rolling in the office. I think we had 9 new. And I think we probably had 6 of those were discs, injuries from car accidents, and one guy was playing ball, and And so we see a lot of that where there'll be pain going down the arm. We'll see some weakness. We'll see pain going down the leg. And I guess one thing that's kind of a pet peeve of mine I keep seeing is that they'll go somewhere, because I would also say majority of those people, we were not always right away the first person there.
Yeah.
They came in for another opinion, or in most of these cases they don't work. It's like they want to put a heating pad on it, and what I see is that just crushes them. Like,
Yeah.
that disc will feel better for 10 minutes, and then it tightens up. Everything around
Yeah.
it tightens up even tighter. And so I always kind of joke, going back to my Panthers, because I know you're a Seahawk fan, but I'm like, we never saw Cam Newton or Luke Kuechly wearing heating pads after the game.
Right. Yeah. They're always in ice baths or something, right?
I mean, we gotta cool that thing. And that's probably like one of the biggest, home things they can do. And then it's all about trying to figure out, what action caused that. And then, a lot of times if it's a compensated factor, if and weightlifting, you're pushing the body, but you don't want to go over the cliff. Like,
Right.
you still, to gain, you have to push it, but you can't. And that's really the whole point of lifting. And so if you do happen to go, then all of a sudden that's when you see the biggest breakdown in structure chiropractically, is like, do you butt wink when you squat? Do you have a little bit of a curve? Are you twisted off? Is your forward head translation? Are you bobbing for apples, or are you squatting? Like, I know your head's going low, but you're not even
Yeah.
activating your
Yeah.
glutes. And so to me, that's what I see the most is just imbalance. And again, they'll go muscular route. They may go, I got to fix this. But again, you and I both know, if the structure beams of the house isn't straight, the siding's never going to stay.
Yeah. Or the roof's going to blow off, all that.
Yeah,
What
yeah.
you brought something up, like people, they just do a heating pad. What are the traditional approaches that you see people come in with like disc cases or different spine complaints? What have they tried before that may or may not have worked? And a lot of these things, if it's disc or it's spine related, a lot of the traditional approaches, they're not getting relief. That's why they're coming to us for results. So what kind of things do you see people do that you go, why didn't you just come to me first?
I mean, straight up heating pad. Then then they go, then it's like they go to NSAIDs, they go to muscle relaxers, and I feel like the world as a whole, as a population, is going, I don't know if this is the right thing. But and then it's like, okay, well then I'm going to start doing shots. And again, the shot thing is so frustrating sometimes on my end, because I'm like, man, again, are you playing for the Panthers and got to get on the field today, or are we addressing what's going on?
Yeah.
And
Yeah.
and so the majority, I would say, I don't know how it is for you, but it's a majority of these people, they're running for discs, and then after the trying the heat, trying the pills, trying the shots, they're at a complete dead end.
Hmm.
The dead end. And so then we have to have that empathy to be like, hey, we can help without drugs and surgeries. And then after we show that, we got to educate that, hey man, that wasn't the right avenue
Yeah.
of
Well, it wasn't
how
the
to
most
approach.
effective.
Nor was no, and that's probably what the most hardest thing of our job is keeping that humble part, because you're just like, it's not the most effective.
Yeah. Well, I always bring up the Tiger Woods thing with 7 back surgeries. And then I just came across a book that Gary Player wrote, and he's 90 years old. And he says golf begins at 50. And for Tiger, golf kind of ended at 50 for, you know what I mean? And it's like, so there's lots of approaches out there, but I think, you and I are on the right path to really help people longevity wise. I had a guy yesterday, super sad, and I was trying to get him to work out with a heart rate monitor, and he had some shaking going on. I was trying to get him to, help himself out. And then 6 months ago, I saw him a couple times and I never saw him again, but he came in yesterday and he just looked really bad. He's wearing a walker. His son brought him in. He just didn't look good. And I was like, man, you've been through the medical gamut. And he's like, yeah. I'm like, well, we got to start getting you healthy and start doing little things to improve your function and your performance. And
Did
you and
you
I have the tools.
did you know that did you know who was on the first Rose Bowl Palmer chiropractic float?
Yeah. Mr. Woods. Pretty amazing, man.
It
You
is,
know?
it is. And granted, obviously there's a time and place for a lot of things. Jumping out of airplanes and helicopters didn't help him, I don't think. But
Yeah, well, lots going on there, but there's a path that leads to destruction in your body, and then there's a path. Most people, they're like, they're overtraining, and then they just break their body down, and they're in a chronic state of stress, and then they come to us, they can't sleep, they're in pain, and it's not just one thing; it's a whole multitude of things that we can look at and help these people get better. What types? I mean, we talked about this a little bit, with the therapies you're using. What procedures do you use in the office to help get people functioning again, get them feeling better, get their lives back on track? What do you do in the office day to day?
so a lot of times, depending on what's going on, we follow basically. I really like looking at people in 90 days and reevaluating. I mean, we reevaluate essentially 30 days, but like really, really taking, a hard dive in there. So we'll start off, we have segmental traction, we have decompression, and then we'll start off with some adjusting there. Now, if it's really, really, really hot, that's when, we used to kind of go to ice pack, but now we started doing the soft wave stuff and we've seen some fantastic results. And then really that decompression is what, you know, rehydrates that discs really. And it's funny because I do feel the population, sometimes it's like, and I'm sure you've done it with the decompression, is that they're like, it's you got to pull more, and it's not that.
Yeah,
It's like there's a system with how that decompression works. Rest, pull, rest.
yeah,
And so that's really how we take care of it in the office. We do a lot of X-ray analysis. We look at the MRIs. We find that exact spot, and then we kind of break it down full body
mhm,
and look at that. And obviously, number one thing is getting out of pain. But you and I both know is we're not going to chase pain. We're not going to sit here and chase it because the pain is going to be secondary or tertiary to whatever's going on. So that's really how we take it. That's really how we break it down is we try to get a thorough intake, try to figure out what the mode of action is there. And a lot of times, I don't know how it is with your disc, but a lot of times with our disc patients too, it's, it's something, you know, I guess we say it all the time. It's bending over to brush my teeth,
yeah.
and it's doing something little. It's, I don't know how it is where you guys are at climate wise, but we're getting to the end of rake and leaf season. And
Yeah, yeah.
and people, that rotation and that rake,
Oh, yeah.
it's
Compression
tough.
and torque. Yeah.
It's tough. So we're getting to the end of that, and this is kind of our cold months, and we all hope for at least a dusting. We haven't got snow yet, but February is generally our coldest. But we don't have a lot of the shovel things in the South here. It's rake, rake, rake.
Yeah. It's physical labor. What do you have any like recent success cases that really stick out in your mind of what you're doing therapy wise that really help people?
One that really sticks out with me is I had a mechanic that was obviously a laborer, working hard, different chords, I guess. And he was like, I just keep tripping on the cord in the garage. And and they traced it. We got an MRI, and we had done a lot of chiropractic stuff, and we had gotten some good results, but it wasn't until we got him on that decompression, and it was instant. When I say instant, though, I swear the nerve never follows the textbook. It goes away, then it goes halfway to the thigh, then it goes away, then it goes down back to the calf, then it goes away, and then now it's in the big toe again. And so definitely in that 60-90 day process, and all of a sudden, you know, that foot came back, and he was just like, I'm not tripping anymore. I'm not, you know, working on car, and he was he was like, I'm thinking I'm picking my foot up. Well, we
Yeah.
can understand how life-changing that is. But also you follow the medical model of that. I mean, they wanted to cut him open 10 days in. It was like, you'll never come back, scare the pants off him, and your nerve will never come back. And guess what? We know the nerve, we remove the interference, the body wants to heal.
Yeah. Absolutely.
And there's even
100% of the time.
cases I was telling him where it'll retract another nerve. It takes a long time, but I was like, you can get this back. We figured out the spot. Now we have
Yeah.
to, give
Yeah.
it the nutrients and the body will become, and they wanted to put an ankle brace on him for the rest of his life, kick
Boy.
his toes up in the air. So,
I had a guy come into my office, and I usually, tell people 6 to 8 weeks. So hardcore decompression therapy, 6 to 8 weeks. I had a guy every visit. When am I going to get better? When am I going to get better? And he's wearing a cane. He's like the grumpiest guy ever. I always said, "You're on the right track. 6 to 8 weeks. 6 to 8 weeks." Week 7, he walks in without his cane. He's like, "Well, I guess I'm getting better." And I'm like, "I told you, 6 to 8 weeks." So it could be 8 to 12, but everybody heals different. But it's a process. It takes time and repetition and commitment, both on your part and the patient's part. So that's kind of fun. Well, so I know we're into the new year, and I always like to find out, what are your top recommendations for people to get healthy, not just get adjusted, because we know that's part of it, but what are some of your top 3 or 5 things that you would tell our listeners to do? If you could do this, this, and this, you're going to shift your health in the right direction.
well, I love doing different things. So, my birthday was New Year's Eve. I think you're the 30th, right?
Yeah.
29th. So, I'm the 1st. So,
Yeah.
I got the big infrared blanket. So,
Okay.
I've been trying to do that 4 days a week with the red light therapy. And to be honest with you, I feel great. I have an at-home sauna, but the number one thing that I love more than anything is the cold plunge.
Yeah, I know you're going to say that.
So, I cannot say enough about it. So, like, those are kind of my 3 go-tos as far
How
as
long? How long do you go to the cold plunge for?
3.5 minutes.
Three. Now, what did you start at? Because people go, "I just got one about a month ago, and I've used it a couple times. I've been doing cold showers to build up. I started with 30 seconds and 45. Now I'm at 90 seconds cold shower. I did the cold plunge a couple times. I'm like, I'm not quite ready to commit to 3 times a week. But how did you start? Because it's funny. My daughter's in gymnastics, and there's a girl that she's a good gymnast, but when she doesn't perform at her best, she cries, and you can see it. And you go, I didn't know if there's crying in gymnastics. But and my daughter, when she has a bad performance, she doesn't cry. So she went to get in the cold plunge, and it took her like 60 seconds, and all the you oh hi versus just get in, you'd be done. And then I looked at her, I go, "Do you think the girl who's crying, not that I'm picking on this, but I'm just saying, those emotions from gymnastics, if you train yourself in the cold plunge, you can overcome these things." So, how did you train yourself to do 3.5 minutes?
So, I'm not gonna lie to you. Every day, I look in the mirror. So, I have a slab of concrete right outside my house where I have my sauna and my cold plunge and the chiller. I will say, I keep it at 42.5.
Ooh, baby, chile.
I would tell you just go below, like, I think 50 and 49 is the start, but every 5 or 6 degrees is a different. I haven't changed it since. I'm definitely I couldn't do the shower. I'm all in or all out.
Okay, okay.
I couldn't do the shower. I didn't have enough discipline to hold the shower there. So, I will say, like, my wife laughs because she's like, "You're so disciplined on it." But I get up at 5:15. I go down there. Um, I put my trunks on. I take the top off. I walk back in. I look at the mirror. I'm like, "I can
What do you
do
say in the
this.
mirror? You can do
I can
that. What are
do
you saying?
this. I
Yeah,
can do
yeah.
this." And then I don't wear an Apple Watch all the time, but then I'll say the watch, 3:30, time it, and I go out and I sit down, I dunk in, and then I try to, it's funny, I call one of our mentors, Dr. Fred, and I'm like, "Give me something," All the patients I seek are seeking me. I try to come up with a rhythm, and I learned that from a podcast on Rogan and I do it with my son all the time. Is what they said, like, one of the best Navy SEAL guys ever was, he always said, "Look good, feel good, ought to be in Hollywood. Look good, feel good." And he had this rhythm. So, like, I guess that's kind of what I do. I try to zone out.
It's kind of a meditative state. I mean, you
But
really
when
you
I
gotta
get
you gotta calm your mind down.
Yeah, and then I try not to you try not to shiver. yesterday was actually, it was 26 out in North Carolina. And so it was cold yesterday when I got
So it's
in, but it
actually
almost felt
warm. It was
in the
warm in the
water.
cold plunge. Yeah.
Yeah, yeah. But it definitely got me shivering. But anyway, then I get out and then I try to do some lymphatic twists, and then I do my B bands. And so when I put my
Okay.
bands
Yeah.
on, I
Yeah.
do a 3-minute wall sit with 30 curls and then 30 presses with 15 or 20-pound dumbbells, and then try to knock out 30 push-ups, and then
Okay.
I'm ready to go. And to be honest with you, I love coffee. I have an in coffee maker in my wall just because I saw Tom Brady had one. I got it. I love it. But I don't need, like, there'll be days I go and I don't even take a sip because I'm like that cold plunge. I'm amped.
Yeah.
I'm ready to
Yeah.
go.
Oh,
And
yeah.
so
It wakes you up. It wakes you up for sure.
and the kid, like you said, my kids will come home. My son does a lot of double stuff. So if he plays 3 lacrosse games and then plays a basketball game, he's like, "Dad, I gotta go. Gotta go." And he does, but it is interesting because, like, he'll stand there, and then he dunks. Then I'm like, "Are you gonna stay?" And he'll be like, "I'll stay. I'll stay."
Yeah. Well, it's
But
crazy. Before this whole cold plunge popular thing, we used to do that playing football. We'd sit in a Hubbard
no,
tank, ice bath. We just called it an ice bath back then. And it's
that
like, oh,
yeah,
put
yeah,
your
and
knee in it. Same thing.
I
We
try
were
to
using it for
explain that.
recovery.
That's what's so crazy to me. I don't know if you see it like I do. Like, this heating pad phase, that's what's I swear the urgent care is like here, like in everything I see, I don't even know what a wet heating pad is, but dry heat. And I'm like, oh, and like you said, back in the day, anytime you ever did anything 2-a-days or anything from high school to whatever, they got into cold. So
Yeah, we were icing it. Ice it. Put some ice on it. My kids
you can
make fun of me.
heat it to play, cool it down. But if you're heating your back up to, like, go run a race and you're trying to sleep at the same time, it's just counterintuitive. But I tell
Yeah.
you, it's 9 out of 10 people.
Yeah, it's crazy. Well, good. I'm glad you're doing the cold plunge. I'm glad we talked about it. So I like to shift gears a little bit because I kind of been. I don't know if you know my story, but I almost died at the golf range, and I mean, I went into
I did
VTAC, and my heart stopped for 4 minutes. They had to shock me and all this. They did CPR, and it was
no.
I was a total mess. So now I'm back on track, and my heart's normal rhythm and all that stuff. So I got a little passion for golf, and my book's coming out here soon, How Not to Die at the Golf Range. So it's the manuscript's getting sent to me right now, so it's almost ready to publish. So we're excited. But I know we've talked golf. You haven't been playing a little bit. You've been busy with your kids, but I always ask my golfer buddies, what's one tip? What's one tip you could give our listeners and our golf community? What's one tip that you could give them to make them a better golfer from a doctor's perspective?
Well, I'm not. I don't have a doctor's. I got a tip just to win. Because you asked me that, I think, in Arizona, and I was like, huh, what was I say? And so I played golf at a really, really young age, stopped, and then started playing again. And my dad was always hands, hands, hands. But I don't know if you've ever done this. I think I heard Arnold Palmer did it. My tip would be, if you got to hit a big shot, squeeze your knees together, release, and swing. And I don't know why, but if that takes my
Okay.
brain, it's the communication. But when I squeeze my legs together, it's smooth. And I've used that more times in a high pressure situation than ever. And that would be my number
Hey,
one tip.
well, I could break that down why that works, why that's effective. So, all right, I'm gonna try that next time I play. I'm actually playing here in a little bit, so I'm excited to play. But squeeze your knees together. It's kind of cool because when I was in the hospital after my heart thing, I was sitting there and I talked to my publicist and I'm like, I really want to rewrite my book, Take Charge of Your Health, and then I'm like, you know what, I really want to write a golf book, and so I came up with like the triunity of golf, which is grip, posture, stance. And then I'm like, you know what? There's a principle in our profession called the 33 principles. I'm like, I want to get the 33 principles of golf. So that's one of the principles I'm going to put in my book. Squeeze your knees together before a big shot. So one of the 33 tips to make golf better. And
There you
there's all
go.
these little things in golf. That's what's golf so fun and it's so challenging because there's all these things you can learn and do.
No,
I
I
just
mean,
like
it's an awesome game. Like you said, I haven't gotten to play as much. I got down to single digit, and um was going around. We played at some really neat places. Obviously, in North Carolina is definitely just like you. There's
Oh
some
yeah.
hotbed courses,
Yeah.
so hopefully we can hit the link soon. Um, there's nothing like it. We get to compete.
Yeah. And the biggest thing, you're competing against yourself.
Oh
So
yeah, yeah,
that's
yeah,
that's the fun part. So,
yeah,
well,
yeah.
good, Dr. Nick, man. Great talking to you, man. Fun show today. I always love talking to you and rapping. And anything else you want to tell our listeners before I let you go today?
No, no, I really appreciate you having me on. I love the invite, and hopefully I shared some knowledge with you.
Yeah, no, absolutely. Yeah. So, I'll put your information in our show notes. So people, if they come across this and they go, oh, I'm going to go see this guy, Dr. Nick in North Carolina, Charlotte. Panther fan, if you're a Panther fan, go see Dr. Nick. If you're a Seahawk fan, I wouldn't go to his office because,
Yep, keep
that's
pounding.
just kidding. Well, good. Dr. Nick, thanks for your time. Appreciate it, man. Hope you guys learned something today. This is Dr. Troy, Everything Disc.